How do you identify pedophilia OCD, POCD? Imagine having thoughts that make you question your own mind and morals. That's what people with pedophilia obsessive-compulsive disorder often experience. They face intrusive, unwanted thoughts or fears about being attracted to children or possibly harming them, even though they have no actual desire or intent to do so. These thoughts are persistent and distressing, and they can come suddenly and repeatedly, causing a lot of anxiety. It's important to understand that these are not true desires but symptoms of a mental health condition called obsessive-compulsive disorder. To recognize POCD, look for certain key features. First, there are intrusive obsessions, recurrent thoughts or images that pop into the mind uninvited. These might include fears of being attracted to children or worries about past interactions where they fear they might have behaved inappropriately. These thoughts are ego-dystonic, meaning they clash with the person's true feelings and values, causing deep distress. People often feel ashamed or guilty about these thoughts, even though they know they are not true or wanted. Next, there are compulsions or safety behaviors that people use to try to reduce their anxiety. These can include mental reviewing, where someone mentally replays interactions with children to check if they acted inappropriately. Others might seek reassurance from themselves or trusted people that they are not a pedophile or that no harm was done. Some avoid situations where children are present, like staying away from playgrounds or avoiding physical contact. Others might perform mental rituals, such as repeating certain phrases or counting to neutralize their fears. Some individuals research pedophilia to better understand their thoughts, trying to distinguish between actual pedophilia and obsessive fears. Confessing or disclosing these thoughts to others is also a common behavior aimed at seeking reassurance. It's crucial to differentiate POCD from pedophilic disorder. People with POCD are deeply disturbed by their thoughts and do not have any sexual attraction or desire toward children. Their distress comes from the anxiety and fear caused by these intrusive thoughts. In contrast, pedophilia involves a genuine and persistent sexual attraction to children, which is a different condition. Those with POCD often experience shame, guilt, and social withdrawal because of their unwanted thoughts. They usually recognize that these thoughts are not true or reflective of their desires, which is a key aspect of OCD. The impact on daily life can be significant. The obsessions and compulsions take up a lot of time and energy, interfering with work, relationships, and social activities. The constant anxiety and avoidance behaviors can lead to feelings of isolation and emotional suffering. Because of this, accurate diagnosis is essential. Clinicians look for the presence of intrusive, distressing thoughts about pedophilia that are ego-dystonic and accompanied by compulsive behaviors aimed at reducing anxiety. They also carefully differentiate POCD from pedophilic disorder, which involves actual sexual attraction and urges. Understanding POCD is vital because it guides appropriate treatment. Evidence-based therapies like cognitive behavioral therapy with exposure and response prevention are effective for OCD. These therapies help individuals confront their fears gradually and reduce compulsive behaviors. It's important to remember that people experiencing these symptoms should seek professional mental health support. Only a qualified healthcare provider can provide an accurate diagnosis and develop a personalized treatment plan. Recognizing the patterns of intrusive thoughts and compulsions and understanding their distressing nature is the first step toward managing and overcoming POCD.